Good morning and welcome to the March 21st Victim Compensation Board meeting. For those of you in the room that are appearing on a specific agenda item or wish to offer public comment, the microphones at the podium and tables are directional and require that you hold them fairly close to your mouth when speaking to ensure your testimony is captured by our audio equipment. For members and participants who are appearing via Zoom, if you cannot hear the presenter, please use the comment feature to note that as staff are monitoring the comments in real time. Council, will you please call the roll?
Member Becton.
Present.
Member Johnson.
Here.
Chair Ravel.
Present.
Thank you. Good morning. The first item on the agenda is the approval of the minutes for the January 31st, 2024 board meeting.
Are there any discussion, additions, or comments to the minutes from the board? Do I have a motion to approve item 1?
To approve item 1?
I second.
Council, please call the roll. Oh, sorry, I do mean to wait for public comment.
Thank you.
Yes.
Is there any public comment on this item via Zoom here in Sacramento or at the Martinez location? Seeing none.
Okay, Council, now please call them.
The motion for consideration is approval of the minutes from the January 31st, 2024 board meeting. Member Becton.
Aye.
Member Johnson.
Aye.
Chair Ravel.
Aye.
Motion passes.
Thank you. The next item is public comment. This is the opportunity for the public to comment on items that are not on the agenda. As items discussed during public comment have not been agendized, the board is not permitted to take any action on these matters at this meeting. Please note, if you wish to offer public comment regarding items 7 through 10, there will be a separate call for public comment when each item is heard by the board. For those on the phone, if you previously indicated your desire to offer comments, during this meeting, we will be calling on you by name or phone number. For those participants via Zoom, please raise your hand if you wish to offer comment, and we will acknowledge you and let you know when it is your turn to speak. Seeing none, we will move to item 3, which is the Executive Officer Statement, which will be presented by Executive Officer Linda Gledhill.
Good morning, members of the board. Good to see all of you. I have a few updates to share with you. First, I wanted to make sure that the board was aware that we submitted the draft legislative report for the forced or involuntary sterilization compensation program to the governor's office for review. This annual report, which is required by statute, provides information about our outreach efforts as well as application and demographic data. Because there are a small handful of applications currently being processed, once we receive final approval, we will update the data in the report so that it is current and share it with the board, the legislature, and the public later this spring. Overall, CalVCB remains proud of the efforts that we implemented a successful program that provided compensation to survivors of this historical injustice. And we're also thankful for stakeholders and our partners who helped us find survivors. I also wanted to let the board know that in early March, we submitted the final Office of Administrative Law, the regulations that were discussed and approved at the January board meeting, the final step in the rulemaking process, and we anticipate a July 1st, 2024 effective date. On February 5th, the Federal Office of Victims of Crime, or OVC, proposed changes to the VOCA Victim Compensation Program guidelines. OVC administers the Crime Victims Funds, which provides funding to states for victim compensation and victim assistance programs that offer support and services to those affected by violent crimes. In California, VOCA victim compensation grants help fund both CalVCB, where the victim compensation grants are administered, and also CalOES, which administers victim assistance grants. This fund is financed by fines paid by convicted federal offenders and other settlement payments. OVC publishes federal guidelines for the use of these VOCA grant funds by states, and they were last amended for victim compensation grants in May 2001. The proposed changes that OVC announced in February have been in development since 2022. They were developed with significant input from stakeholders, including states, and including I attended a meeting in Washington, D.C. about these regulations last year. The proposals reflect changes to the federal statutes since that time, including the 2021 Vote to Fits Act. They also reflect updated policy environment regarding victim compensation. The updates, if enacted, could lead to significant changes regarding who is eligible for compensation, what factors can be considered to determine eligibility, and what expenses qualify for reimbursement. Public comment on these proposed federal rule changes must be received by April 5th, 2024. And CalVCB is currently working with the administration to determine whether our organization should submit public comments. Given the current budget climate, our primary concern is the financial sustainability of changes proposed in the amendments that could significantly increase ongoing costs. We do not anticipate any additional funding that comes with these changes. If CalVCB does submit public comments, we will certainly share those with the board. And of course, we will continue to monitor these federal changes and update the board throughout the process. We also wanted to make the board aware of an administrative issue related to paying PC 4900 claims, or that you all approve at this board. CalVCB received a $7 million appropriation to pay PC 4900 claims in the Budget Act of 2023. However, this amount was almost $100,000 too low to pay the 3 claims approved by you in the January board meeting. We paid 2 of the claims in full and made a partial claim payment on the 3rd claim. We have received approval from the Department of Finance to make the full payment on the 3rd claim, and that second check was mailed to the claimant. But for the rest of the fiscal year, CalVCB will need to seek approval from the Department of Finance to increase the appropriation before being able to pay these PC 4900 claims. This increases the processing time to get the final claimants to victims, and we continue to work very closely with the Department of Finance on this issue. I wanted to also touch on a couple of issues that you will hear about in greater detail during this board meeting. One of the action items on today's agenda requests the board approve CalVCB's recommendation for awarding grants to trauma recovery centers. As we mentioned in the January meeting, we received 19 applications requesting about $35.8 million in funding. We currently estimate that we have $12.5 million in available funding for grant awards, and therefore will not be able to award all applicants at the level that they requested. Our recommendation, which you will hear about more later, is for the board to approve the top 9 applicants who scored more than 50 out of the 100 possible points during the scoring process. The process for determining the amount of the awards largely matches the methodology we used last year. And if the board adopts this recommendation, CalVCB would fund 7 existing TRCs, which are all of the existing TRCs that applied, 1 previously funded TRC, and 1 new TRC. Also, during this meeting, you will receive more information about an update on our civilian statewide marketing contract. We are pleased that Civilian aims to launch its marketing campaign during National Crime Victims' Rights Week, which starts on April 21st. CalVCB has worked closely with Civilian to prepare for this exciting launch, and we look forward to the campaign and increasing public awareness engagement. For the month of April, CalVCB has other activities planned to recognize National Crime Victims' Rights Week and Sexual Assault Awareness Month. We will be sharing a toolkit with our partners and the public around National Crime Victims' Rights Week to help spread the word about victim services and resources. We will also be hosting our annual denim drive throughout the month of April to collect new or gently used denim. We will donate the denim to the Community Against Sexual Harm, or CASH, which is based here in Sacramento. CASH assists human trafficking victims by providing survivor-led peer support and harm reduction services, while also providing education about the harm inflicted on women. CASH told us that they have a closet that they use to help women get back on their feet, and that everything we collect will be used to help those people directly. There'll be a donation bin in the first floor lobby of CalVCB's building, where the public and CalVCB staff will be donating jeans, and we will observe Denim Day officially on April 24th. So that concludes my remarks, and I'm happy to answer any questions.
Thank you, Officer Gledhill. A couple questions. First, with respect to the VOCA regs, if those were to be finalized as proposed, would those require conforming statutory and regulatory?
It would absolutely, yes. There are several areas where it would require conforming statutory changes and then regulation changes here at the state level. One of the things that's unclear is with the timeline. If the federal government does approve these regulations, we don't know the enactment date. California actually has a more robust legislative session than many states, as you might know. Some states only meet once a year, once every other year. So I think the federal government is going to have to take that into consideration, as almost every state would have to make some kind of statutory change to be compliant.
Thank you. And on the 4,900 payouts, we're seeing an increasing volume of these claims. Has there been any discussion with Department of Finance about increasing the annual appropriation to account for that so that it isn't causing this administrative burden on you and on the claimants?
We have had those discussions, and we will continue to have them as we roll into the next fiscal year.
Thank you. Are there further questions or comments from board members? Okay. Thank you, Officer Goodhill.
Thank you. Item 4 is the legislative update, which will be presented by Deputy Executive Officer Katie Gardinas.
Good morning. Since my report at the January meeting, a few key bills have been introduced that could impact CalVCB. The deadline for bill introductions was February 16th, and we are in the process of analyzing these bills. AB 2307 by Assemblymember Davies would authorize CalVCB to reimburse up to $1,000 for self-defense courses. This week, that bill passed out of the Assembly Public Safety Committee and was referred to the Assembly Appropriations Committee. AB 2979 by Assemblymember Mike Fong would state that victim compensation and Good Samaritan payments received from CalVCB are excluded from the definition of gross income under the Revenue and Taxation Code. It was introduced as a spot bill and amended with specific language this week. It has been referred to the Assembly Public Safety Committee. SB 1430 by Senator Glazer would require the Department of Justice to issue a certificate of innocence to an individual with the finding of factual innocence. It would also require a individual's criminal record to be annotated by the Department of Justice and other law enforcement agencies. This bill is scheduled to be heard in the Senate Public Safety Committee on April 16th, and we're evaluating the impact that this bill's language may have on CalVCB's process for erroneous conviction claims. Those are the highlights, and I'm happy to answer any questions.
Thank you, Deputy Cardenas. Are there any questions or comments from the board? Thank you very much.
Is there any public comment on this item via Zoom here in Sacramento or at the Martinez location? Seeing none, we'll move to item 5, which is the contract update, which will be presented by Deputy Executive Officer Sean Ramirez.
Good morning, board members. Today's contract report is informational. There's no action required of the board. If you'd like ask any questions, I'm happy to answer.
Are there any questions or comments from the board? Thank you.
Thank you. Is there any public comment on this item via Zoom here in Sacramento or at the Martinez location? Seeing none. We will move to item 6, which is the update on the marketing campaign with Civilian Inc., which will be presented by Deputy Executive Officer Katie Gardinas.
As the executive officer shared in her report, we're very excited today to share the progress we've made on our 3-year, $3 million marketing campaign with you. Since you approved that contract with Civilian in July of 2023, we have been working very closely with them to plan our statewide awareness campaign, which we plan to launch the week of April 21st, National Crime Victims' Rights Week. To measure the success of this campaign, CalVCB will be closely tracking certain metrics. We'll be looking at the number of applications that are submitted, also our website hits and social media impressions. We also plan to track the amount of compensation that's reimbursed over time, although because we are a reimbursement program, we might not necessarily see as much increase in that particular metric. At the end of the campaign, we're also going to compare the results of our pre-campaign survey and our post-campaign survey with the hopes that we see increased awareness among Californians about CalVCB and the services that we provide. During the initial planning stages, we shared a lot of information with Civilian about our processes for how we issue compensation. We shared data that we have collected about CalVCB and prior research that we had sponsored around application rates and crime rates. And then late last year, CalVCB or Civilian did and launched the pre-campaign public awareness survey, which gave us some initial information about how many Californians know about CalVCB, what they know about the services that we provide, and what their thoughts were about the best tools to market our information. Could you put up the slide, please? The slideshow? And could we go to the next slide? We wanted to share with you some of the demographic information from the survey. What you can see is that we received responses from a pretty good range of Californians when you look at things like age and gender and background. This was information for 600 individuals from the top 15 most populated counties in California. And we also asked Civilian to get information from folks in Shasta and Butte County, so we'd have some representation from Northern California. We also wanted to highlight that out of everyone who participated in the survey, 21% identified as being a victim of violent crime, and 30% were identified as being underserved because they engaged in some type of social program, such as Medi-Cal or CalFresh. The key findings from this survey, which were included in the board item, highlight the importance of this marketing campaign. Like I said, not many Californians had heard of CalVCB or knew what our services were. And then after learning about what we do, the good news is that they wanted to share that information with other people that they knew. The survey respondents also recommended that we primarily use digital advertising to get our message out. In January of this year, Civilian also tested some creative concepts with 101 focus group participants. Could you please go to the next slide? This is a version of the marketing poster that we're planning to use for the campaign, and it reflects the findings from Civilian's work. The major highlights are that the word rebuild was seen as very positive from the focus group participants. They also told us that inclusive graphics and language was very important to inspire people to learn more about CalVCB. And the imagery of the hands that you see on the side was viewed as being a universal symbol of support and recommended by the focus group. Next slide, please. This draft social media post is also an example we wanted to share with you because one of the other findings from Civilian was that real life stories or things that mimicked real life would help people engage more with our campaign. And so this social media post would show as a video on something like Instagram or Facebook, and it shows text messages between two fictitious people talking about what's happening, receiving CalVCB services and how it helped. And this is a good example of how we plan to use plain language and more engaging content to try to get people to learn more about our services. Lastly, I wanted to go over our plan for media buys. We're planning on purchasing advertising in key markets. And because of the finite amount of funding available, we've decided to do digital advertising in 15 counties that we chose based on their crime rates or their population. We're also planning on doing those advertisements primarily through social media and on web pages. And we're going to work with some well-vetted social media influencers that are from the medical and mental health communities. And that's based on feedback from the focus groups that people thought they would trust information more if it came from people in the medical or mental health communities. Additionally, we have some emphasized marketing that we're doing in 3 priority counties, Kern, San Diego, and Los Angeles. Again, they were chosen because of data we have about discrepancies between crime rates and application numbers. And for those 3 counties, we'll do additional, mostly audio advertising on the radio to try to increase awareness of our services. Because of the funding of this campaign and the ambitious goal to increase awareness not only across California, but also in specific underserved populations, we're not able to do some more expensive advertising methods like television advertising, but we are planning to work very closely with Civilian and our partners so that we can capitalize on this contract as much as possible. So if you go to the next slide, it just says questions. I wanted to let you know we have 2 folks from Civilian who have joined us today in case you have questions that they can help answer. So Hannah and Camelia are on, and I'm happy to answer any questions you have.
Thank you so much, Deputy Cardenas. This is really exciting work. I think it's so important what you're doing. and getting the word out. I think that's one of the major priorities of the organization, is making sure that people know about the services that are available to them, because the visibility just isn't what we want it to be. I think it'll be really exciting to see whether this is successful and ends up bearing fruit. Are there questions or comments from our fellow board members?
Chair, I just want to echo your sentiments. I really am excited about this work. I think getting the word out about the program is critical, and I'm just glad to see that it's moving ahead. Particularly, I'm glad to see the focus on sort of baseline study to understand, to establish metrics to understand the impact of the campaign. Because I think once you have a sense of what works, then you can replicate it down the road. And I think that that kind of data is going to be critical. So really appreciate your effort on that and the advanced work that was done by the team. So kudos.
Member Becton.
Thank you, Chair. I would echo the sentiments already expressed, but I just want to say this is really exciting work. And I'm very appreciative of the outreach and your attempts to reach people so that you had good feedback about what would work in the advertising campaign. I think the most important thing here is that people get to know about the great services that are available. And this is certainly a step in the right direction. So thank you for the work you're doing.
Do we have any public comment on this item? Looks like there are a couple folks with their hands raised.
Good morning. This is Tina Rodriguez. I just had a question on that. On the social media graphics and videos and content that was created, do you have it available in Spanish?
We will be translating many of these materials in Spanish once we finalize the content in English.
Thank you.
Dr. Castro?
Good morning. My question was about languages also. Will it be translated in multiple languages? And will there be any information about how to connect with victim advocates who can assist in applying for the services? As the former chief of the San Francisco District Attorney's Office, I know one of our primary roles was to support survivors in completing the applications and getting the necessary documentation, which is really difficult for people who speak other languages or have different capacities for reading or writing.
We're working really closely with Civilian to figure out what languages make sense for different paid marketing campaigns. So yes, we're definitely looking at opportunities to translate our materials as needed. Civilian's also helping us revamp a lot of our fact sheets and other information that we use that are available on our website. And those we also will be looking at translating in other languages. And those fact sheets include some of the higher level information that Dr. Castro Rodriguez is referring to around connecting with victim advocates.
Thank you. Ms. Petros.
Yes, thank you. It's great to do campaigns and outreach for victims to know, because yes, so many don't know. But my concern is what needs to be fixed when these claims are arriving at CalVCP and why they're not being paid for some reason or another. That is really the real issues and problems that need to be fixed. At your November 16, 2023 meeting, I expressed a concern about support loss not being processed continuously because there is not even a triggering system that lets staff know to process future support losses. And I asked for someone to connect with me. I addressed you politely, professionally. It's been 4 months. No one has called me, emailed me back. If I was the executive director there, it would take me less than 24 hours to look into this matter, because I said the case has been 7 years. So this time I'm going to go further more and give you the 3 claim numbers. And I'm doing it to bring it to the highest attention, the board members, the executive staff, and the public that is watching. So it's A16-599-5436 for the wife, A16-599-5527 and 816-599-5501 for the two children. An innocent college professor was shot and killed. This claim is eligible. This family is eligible for up to $70,000. The claim is eligible. The initial support loss was processed as fully reimbursed by life insurance. But for the past 5 years, there is a loss that should have been paid. And I've asked for the status and brought it to the attention, but nothing happens. Again, I think there are thousands of cases, and all you need to do is run a program for this category and see how many claims have been submitted and not followed up with support loss, because support loss is a continuous processing. Please fix the problems, because if you're not prepared, more victims can come to you, and they're even more traumatized by being denied or delayed. Thank you.
Thank you, Ms. Petros. Do we have any other public comment? Seeing none, I think we can move to the next item.
Thank you. We'll move to item 7, which is the proposal to approve Trauma Recovery Center grant awards, which will be presented by Deputy Executive Officer Katie Gardinas.
Thank you. LVCB is charged with administering the Trauma Recovery Center grant process. TRC grants are awarded on a 2-year cycle, and there is no limit to the amount of funding that can be requested, and there is no guarantee of funding regardless of whether a TRC was previously funded or not. In this cycle, applicants requested nearly $36 million in grant funds, and there is approximately $12.5 million available to distribute. 19 organizations applied for TRC funding, but 2 were disqualified because they did not meet the minimum qualifications outlined in statute. Although 17 demonstrated that they could meet the minimum qualifications, 8 of those applicants received very few points with scores between 30 to 47 out of 100. Funding for the TRC program currently comes from 3 sources: the Restitution Fund, the Safe Neighborhood and Schools Fund, as well as one-time funding from the state's general fund, which was appropriated in the Budget Act of 2022. The only guaranteed funding for this program is the $2 million from the Restitution Fund. The numbers from the Safe Neighborhood and School Fund and the general fund that are included in your binder are budget estimates that CalVCB will confirm after the May revise. Notably, last time since the board approved grant awards for the existing TRCs who reapplied this cycle, which was in 2022-23, the Safe Neighborhood and Schools Fund has decreased by about $7 million. This decrease in revenue is a significant reason why the proposed grant awards this year are lower than the last time these existing TRCs applied for grants. For this grant cycle, CalVCB introduced the Notice of Funds Available, or NOFA, in December and received applications from interested organizations. The process of scoring the applications is consistent with previous board-approved practice. CalVCB takes the minimum qualifications as outlined in statute and determines whether the grantees meet the minimum qualifications using scores. Consideration is given to things like geography and how quickly an organization would be able to get up and running as a TRC, and these scores are used to inform the recommendation provided to the board. Although there are clusters of trauma recovery centers across the state, CalVCB has no control over who applies to this grant program or where they are located. And in developing this recommendation for the board, CalVCB did consider options to maintain or provide services in as many geographic areas as possible, given the amount of funding available, the amount of funding requested, the number of applicants who applied, and the scores that those applicants received. CalVCB's funding recommendation uses a similar methodology as approved by the board in March 2023. Specifically, the recommendation the board adopted included capping the maximum funding at $2.2 million for the 2-year cycle, and then applying a percentage based on the score the TRC received. Although the monetary cap and the tiered funding methodology are not in statute, they provide CalVCB with a fair methodology for granting money given the finite amount of funds available. As I mentioned earlier, we estimate that we have $12.5 million available to distribute and $36 million in requests. There are 17 organizations that met those minimum qualifications. And just as a reminder, 8 applicants received low scores between 30 and 47 points out of 100. Therefore, CalVCB recommends funding 9 TRCs, all of which scored more than 50 out of 100 points during the scoring process. This recommendation includes funding 7 existing TRCs, which are all of the existing TRCs that applied, 1 former TRC, and 1 new TRC. We did have to reduce the funding percentages for the Tier 2 and Tier 3 TRCs, but that was necessary so that we could fund all of the TRCs who scored within Tier 3. It was also necessary so we could fund all of the existing TRCs. We did consider other alternatives as outlined in the board item. However, we believe that this recommendation is fair, it's financially feasible, and it balances the objective to provide services across the state. We seek that the board approve the Trauma Recovery Center grant awards as recommended and further authorize staff to increase or decrease the awards as necessary to reflect the funds available following the governor's revised budget in May. I'm happy to take any questions.
Thank you, Deputy. Are there any discussion on this item from the board?
Chair, if I can just first off, obviously it's tough in a reduced funding in a tough budget year. That's it's hard to see these awards go to up front. I was curious, and I just so my own ignorance here, remembering how the scoring is done and what goes into it. When you look at the this sort of it's established across the state, is there within that scoring criteria, is there sort of a metric that says these awards match the needs across the state, or these awards meet the needs across the state better than others, or whatnot? How is that factored in terms of the established demand?
So that's one of the statutory requirements that we score the applicants on. So each applicant helps us understand what the need is in the community. So the existing TRCs, for example, will describe what services they're providing and to how many people. New TRCs will provide estimates on who they could serve. Within those answers, they talk about things like crime rates. They talk about the provision of other services and the availability of other services in the community. And so the extent to which the organization is able to establish need will increase their score, if that makes sense.
Great, that's helpful. No, that's helpful. I appreciate it. Sorry, thanks. Getting close to the mic here. And then I guess I just wanted to check in. You double check on something. You said that all of the previous TRCs that have been funded that applied this year are awarded. Is that correct?
That's correct.
So there's nobody sort of that's losing funding that had been previously funded in the last cycle. Is that correct?
So it's correct in terms of everyone who applied who currently exists will be receiving an award.
Right. So those who applied. Okay. I just wanted to confirm that. Thank you.
Although the award might not be everything that they asked for.
That's correct.
Yeah, sure. Obviously, and I think we'd all would prefer that it were if we could, right? Okay, that's all. I just wanted to check on those few things. I appreciate your patience with the questions.
Of course.
Yeah, obviously not. It's a tough budget situation, and the need is so great here. In my view, based on the information that you've provided, it's a fair distribution given the applications that you've received and the geographic distribution. It's just awfully tough. But when you have a situation like this with the budget, it's just, you have to make hard choices. Okay, before we move to public comment, is there any other discussion from the board? Yes.
Chair, just one additional question, and I think I remember this from last year. If a TRC rejects the funds because they don't meet their needs, does that go back into the general scoring criteria and reevaluate it, or does it go next on the tier? How does that work?
We would factor it back into the total amount available and then probably adjust those funding percentages again so that the distribution is fair among all of the TRCs based on the tier that they scored in.
Sorry, so it wouldn't go to a new next on the list of the TRCs. It would just get distributed to the existing potential those who were initially funded.
That's what we're recommending. We didn't recommend the board fund the tier 4 TRCs. And again, it was because they had relatively low scores. So we're recommending that the funding stay within the tier 1, 2, and 3 TRCs.
Thank you.
Okay, do I have a motion to approve item 7?
I'll move to approve item 7.
I'll second.
I second. Oh, go ahead.
Is there any public comment on this item via Zoom here in Sacramento or at Martinez location? And I do see one here via Zoom. Dr. Rodriguez, go ahead, please.
Thank you very much for the opportunity to comment. Although it's after the item was approved, I'd like to share some information. My name is Dr. Gina Castro Rodriguez. I'm the Executive Director of the National Alliance of Trauma Recovery Centers. We're the head of an alliance of 52 trauma recovery centers across the United States and 22 trauma recovery centers here in California. I appreciate the difficult position that CalVCB administration is in doling out dollars that are declining and reducing. But this is a very unique situation with the Trauma Recovery Center model that I'd like to explain a little bit. Trauma Recovery Center is a model that is evidence-based through several random control studies. We have found that the construction of the entire model produces significant impacts for survivors, positive impacts and declining of PTSD symptoms, declining of trauma reactions, increasing in capacity for survivors to heal and recover, which includes taking care of their family, being able to work, being able to join their community again. But the model itself requires a structure that allows you to implement all pieces of the model. And so to have fidelity to the model means that you have to have all of the elements of it, including the a group of people that work in different positions in order to provide intensive case management, to do extensive outreach, to provide mental health services, and to be advocates for crime survivors. Our suggested minimum budget for a TRC to do this work and have those positive outcomes that we can verify is $1.1 million. So when funding is decreased in this way and distributed in this way, I understand the sort of idea of equity and being equal and trying to fund more TRCs and new TRCs. But what it actually does is take away the capacity of existing TRCs to follow the model and do the work, as well as handicap the new TRCs that receive a significantly lower amount of money and will not be able to implement the model. So these decreases in budget, which we know are coming from the larger source, have a very serious impact. It will definitely lead to about half the numbers of survivors being served in California. Those are survivors that are in the throes of trauma because they were victims of crime by no fault of their own, and their lives have been devastated. It's gonna produce a gross layoff of staff members who are trained and skilled in doing this work and will not have the opportunity to serve survivors. And it's going to have a big impact on the community and the resources that we have to help people not just intervene in violence, but this model actually prevents future violence by helping people to recover from trauma so that they can get back to their lives, taking care of their children, being productive parts of society, and prevent their own future victimization or violence. And so it's going to have a very big impact. We understand the need to have new sites, and that's what we do all across the country is help states and counties implement new TRCs, but it is not effective when those new sites receive $4,000 or $5,000, $100,000 to start a site. It would be like if we said our community needs a doctor and we'll give you $10,000. It's not enough money to do the work that has to be done, and it won't allow the community to have the impact that we know can happen with the proper amount of funding. Additionally, new trauma recovery centers have ramp up time. They have to hire staff. They have to be trained, and we provide that training. We provide technical assistance. We help them create their policies and procedures. We even help them with hiring. But all of that takes time. And so the new communities will need time now to ramp that up. At the same time, we'll be losing services across California. Our recommendations are, one, to fund the existing trauma recovery centers to the maximum capacity so that they can try to negotiate and deal with the impact of those decreases to the best of their ability and continue the work that they're already doing. To stop funding new trauma recovery centers until we have new dollars that can give those trauma recovery centers the tools and the resources they need to be successful and implement a model that we know is effective, proven through data and research over and over again. And that CalVCB create an advisory board of content experts and crime survivors to help guide and inform these processes in the future so that everyone understands the value of the trauma recovery centers, the impact that they have, the needs that trauma recovery centers have, and how we can do better for violence and violence prevention in California. Thank you again for the opportunity to speak. We are proud to represent the 52 trauma recovery centers across the United States, and we'll continue to advocate for many crime survivors that are experiencing trauma and loss every day. Thank you.
Thank you, Dr. Castro-Rodriguez. And just to clarify, the board has not voted on this item yet. We will do that after public comment.
Thank you.
We can go to the next comment.
I think Stacy Wiggle was next.
Thank you. I also appreciate the opportunities to speak to the board directly on this matter. I am Stacy Wigall. I'm the director of the Trauma Recovery Center Training and Technical Assistance Program with the National Alliance of Trauma Recovery Centers. I was a part of the founding team that developed this model back in 2001 and have been a part of supporting the replication of this model since 2013 in California and then in other states across the country as well. And in our work, in our technical assistance work that we do with trauma recovery centers, we help them build capacity for implementing this evidence-based model, as Dr. Castro-Rodriguez referred to, that is very comprehensive and provides the wraparound and individualized services with the goal of meeting the needs of survivors of violence in marginalized and underserved communities who aren't connecting with other services that exist for help and services and recovery support after violence. And this model was not only became replicated as of 2013 in the state of California, but the core elements of it were codified into legislation in 2017. So there are elements that new trauma recovery centers need to be able to provide in order to both to succeed in their mission and to meet the deliverables for the trauma recovery center grants. And in our technical assistance work, what we see is that when programs are significantly underfunded, they're not only not able to deliver these comprehensive and individualized services, but they're also not able to succeed in meeting their grant deliverables. So it sort of sets programs up to fail. I also just want to add that another thing that we see is that when TRCs are underfunded, it doesn't mean that they're able to do business as usual, but just a little bit less. It significantly impacts their capacity to deliver these services. So, for example, when programs have to lose staffing and end up with significant wait lists for services, that means many survivors on those wait lists fall off. Acute survivors of trauma do not do well on wait lists for programs and don't end up connecting with the services that they need that's going to help them recover and also help prevent future cycles of violence. It also means that staff in underfunded programs are asked to do much more with less, and it contributes to the inability to effectively respond as a team in crisis situations and provide the support that's necessary. It contributes also to burnout and vicarious trauma for staff in this work, and also makes it difficult for TRCs to remain staffed in those conditions or to hire candidates, trauma clinicians, and other staff to be a part of these programs and be effective in their work. So we really do appreciate the opportunity to comment on the potential impact of these funding cuts and and respectfully request that the board consider all of the impacts involved. Thank you very much.
Thank you. Carla Richmond.
Hi, also want to thank you for this opportunity to speak on this important matter, this important proposal. My name is Carla Richmond. I'm a licensed clinical social worker and a lead clinician, a supervisor, coordinator of the training program at the San Francisco-based UCSF Trauma Recovery Center, where I've been for 17 years. And I just want to echo what many of my colleagues and community members are sharing about our really very deep concerns about the impacts, the potential impacts of such a significant drop in funding. That, this is a rough estimate, but, we would reduce at the San Francisco Trauma Recovery Center our individual case capacity by 168 cases a year. That would be, in a year, the total would be almost 340 individual cases over the 2-year grant. And, it was already mentioned about the concern about wait lists. At our current capacity, we're carrying a 30-person wait list. And that's at our current staffing level. I really am very concerned about what this would look like, should we have even significantly less capacity than we're operating at right now. The need we have been observing is only growing, especially with more understanding about the potential benefits of trauma-informed care. And we've just seen it here at our clinic about how about the need only continues to grow, and around especially accessing our services, which really this model reduces barriers to care for our most marginalized, most impacted community members who fall out of regular care. And as was noted, when they're sitting on wait lists, are often then vulnerable to all the other intersecting stressors, things like substance abuse, things like impacts on on how they're accessing medical care, all things that our model really helps with earlier intervention, and by reducing barriers helps to really interrupt the compounding impacts of those crimes that our survivors experience. As has been mentioned, a reduced capacity that this would result in would also mean that it would impact our ability to do community outreach, to do training. So it would have a ripple effect in limiting the ability of us to share our trauma-informed training knowledge, to also reinforce and support other services in our community here in San Francisco. It would also affect the case management support that we provide to survivors of crime. And it would also, as mentioned, impact the retention of existing staff, have huge implications for burnout. And then that is another layer, right, of impacting our capacity to provide these services, not only impact for our staff, on their, stability of their careers and their families. And I think it's important to point out that the San Francisco UCSF Trauma Recovery Center, we are the only clinic providing these very specialized trauma-informed care services in our area. And we repeatedly, I can just speak from my own personal experience as someone who's receiving these calls on a daily basis, receiving referrals on a daily basis, how significant it is when we are needing to, when we have reduced capacity, to be able to tell people that these specialized services that we know make such a difference in interrupting the impact of cycles of violence, that we can't make these available or can't make these available readily. And as has been said, the result of this won't only be a reduced numbers of individuals that we can serve, which is significant, but it really makes a difference when we're talking about reducing the quality and the capacity of our clinics to provide these high level of services. It really means that we will be really undermining the capacities of these survivors to really recover from the crimes that they've experienced. So I'd also like to offer our proposal, which is rather than funding new TRCs and really diluting the ability that we have to provide the needed, the inadequate level of care, is to take the proposed allocated $2 million and give that to the existing fully operational TRCs. Also to extend the funding cycle to 3 years, and allow more flexibility with rollover funds for the 3 years. To also have longer term programmatic and staffing planning that would allow for longer term programmatic staffing and planning to fully execute the grant funds. What we're looking to do is really to maintain and, if anything, enhance the quality of the care that we provide, given that we're using a model that is proven to really interrupt cycles of violence and is such a benefit to our community. I want to really thank you again for this opportunity to share these remarks.
Thank you, Ms. Richmond.
If I could add something just really quickly, I just wanted to clarify that under the statute, CalVCB is charged with administering a grant program, and that grant program is competitive. And so I just wanted to make sure it's clear that this is not a program that was set up to have ongoing funding, but it is a grant program that's competitive and that organizations can seek additional sources of funding as well.
Thank you, Deputy Cardenas.
Thank you. Amy Turk, please go ahead.
Thank you to the Victims Compensation Board for your time today. I'm Amy Turk, the CEO of Downtown Women's Center. For the last 10 years, Downtown Women's Center, in partnership with the leading victim service provider, Peace Over Violence, has operated critical trauma recovery center services to all victims in the LA community, with a particular expertise in serving women and gender diverse individuals who are experiencing homelessness and gender-based violence. We were the third trauma recovery center in California, following the esteemed model created out of UCSF. And though we're extremely glad that existing TRCs are put forward for funding this year, it's devastating to see the deep cuts to all the TRCs in the proposal. We know there needs to be more TRCs across the state, but at the same time, adding 2 new is diluting from the existing TRCs and will completely hobble our services. Come July 1, though, of course, we will be fundraising to supplement. This will result in layoffs and less services to those who need it the most. Our proposal is to not fund the 2 new ones and to continue to support the infrastructure of the existing TRCs while we find new funds for more TRCs desperately needed across the state. This is happening simultaneously in a related issue where all victim service providers are facing even deeper cuts through the decreases in VOCA funding, Victims of Crime Act funding. So basically in California, our budget is stating a value that we are not going to serve survivors of gender-based violence and victims at the same level that we have before. Thank you for your time and for considering other ways to increase the funding for this critical service.
Thank you, Ms. Turk.
Thank you. Wendy B.
Yes. Hi, good morning. So I'm here sort of representing both hats. So my name is Wendy Blanco. I'm the director of clinical services at Peace Over Violence, which is co-funded with Downtown Women's Center, but I'm also a private practice owner. And so I wanted to share some reflections as an owner and how tough it's proven to be to sustain a business while expecting reimbursement from BCB funds that is meant to help insured victims of crime. We have experienced delays in application approvals, denials due to administrative issues like missing dates or lack of efforts to contact the client, long wait time on the customer service line, a minimum of 1 hour each time we call, and arbitrary rules like only checking 3 claims at a time, and then you have to call back for follow-up on other claims. So this has proven to be a system that is not meant for continuity of client care, because client care is consistently disrupted and the protocols that are in place are not aligned with mental health needs and values. So as a business owner, we cannot sustain taking on BCB clients because the cost is too high. And it also isn't ethical for clients to be seen and their care be disrupted. So having TRCs was a game changer and wonderful to see clients that could have access to services immediately without the red tape of reimbursements or without the red tape of having to wait for 3 months of approval in order to continue their mental health care. So this was a lifesaver for clients and agencies that needed the money to sustain their important work. This is something that is necessary, and TRCs are continuing to grow. New TRCs are opening because there is evidence that the model works and it's helping clients directly when they need it the most. Now to hear that there are major cuts to the budget, some budgets maybe even cut in half, actually being cut in half. This is detrimental to the work that we have done so far, and it's taking multiple steps back. This requires cuts in personnel, which translates into cuts in services that impacts clients directly. These are services that survivors of crime need, but also is the least that we can do for the harm that they have endured, right? This then translates into effects on community. When folks are not getting healing that they need, they disconnect from community and they no longer have the resources to prevent things like homelessness or access to mental health care. Resources that they need to relocate for safety, to cover medical and dental expenses. So these funds are a great benefit, and evidence shows that the model is effective. But cutting the funds can affect clients' trust in our agencies, the client's hopefulness to change, and the staff morale, right? We believe that we're lucky to do this work, but having these unexpected cuts from in fact, multiple agencies in our LA area, for example, is detrimental to access for all. And inevitably, our clients will be displaced if we're seeing a shortage in access now and long waiting lists. Cutting our programs in half is only going to increase that. So I'm here to echo the same sentiment that everyone has shared, but also to request what our partners at EWC have requested, and which is not to fund new TRCs, to continue to fund the existing ones, because I think sometimes it's the perception of like we're funding more, we're increasing, more agencies, but the reality is the funds are not meant to sustain these programs that are lifelines for people. And so I just wanted to share some of those reflections, because if people are not able to access private practice therapists, which VCB funds cover, and if they're not able to access trauma recovery centers, which VCB is supposed to cover, then where do our clients go? Especially because we are targeting clients that are uninsured and have no other resources, like literally no other resources as a result. So thank you for letting me speak.
Thank you for your comment.
Okay, next we have Mong Kim.
Hi, thank you. Thank you for the opportunity to share. My name is Myung Kim, and I'm the Chief Program Officer at the Downtown Women's Center. I wanted to share that I have been overseeing our program's TRC for the past 8 years, and this past year has actually been the hardest year to hire clinicians. The interest of mental health clinicians to serve in our communities have dropped, especially after COVID. So we've had a really, really hard time hiring new talent as well as retaining the current talent. So my concern is that with all the funding cuts that are happening and the inevitable layoffs that will happen, that it will impact the retention of our current staff and the current talent that we have worked so hard to hire this past year. It will also cause a ripple effect in the community. I think that it's going to cause TRCs to have a negative reputation among clinicians who are seeking employment in our organizations, and it will cause them to question whether they want to commit their longevity of their career to a trauma recovery center because the funding is so unpredictable. And so I really wanted to raise that and for us to take that into consideration as we look at all of the issues today. Thank you.
Thank you, Ms. Kim.
Ed Little, go ahead, please.
Good morning. Can you hear me?
Yes.
Thank you. My name is Ed Little with Californians for Safety and Justice and Crime Survivors for Safety and Justice. And I want to underscore the remarks that my colleagues have made already. And I would like to share that we as an organization represent tens of thousands of survivors of crime. And the work that trauma recovery centers do to help heal and repair people who have experienced just challenges in their lives and trauma is invaluable. And I would ask that, the board take a pause and reevaluate the current funding scheme and take into consideration what my colleagues have shared. One of the things that I have heard from many of the folks who run TRCs is the challenge of hiring clinicians because of the challenges with funding. And, if we want to invest in this model, a part of it is making sure that, people are able to execute this work to the best of their ability. And that requires having the resources necessary to do that and to be able to hire the best people possible to provide these critical services. And so, I think it's just I would recommend that, we really reconsider, expanding this to new TRCs when the current TRCs are doing really good work and need the resources that are currently available, however limited, to be able to do the important work they do in very marginalized communities. And so, I just want to just ask you to reconsider and maybe send this back to the board to reevaluate the funding scheme and to maybe take this up at a later date. But I would hope that you wouldn't vote on this right now. I want to thank you for giving us the opportunity to share before you make a decision, because these resources are critical and they impact lives of many individuals, families, and communities. And I would hope that the board would take the remarks and the comments that have already been made into consideration before you make a final decision. Thank you.
Thank you, Mr. Little.
Could I make a comment really quickly?
Yes, of course.
I just wanted to clarify that based on the statute, we don't believe we have the statutory authority to be able to only fund the existing TRCs. Again, this is a grant program, and we completely recognize the important work that these organizations do in the communities. We work closely with them, so we understand the benefits and the services that they provide to survivors of violent crime. But I did just want to clarify that based on the statute, we can't fund only the existing TRCs.
Thank you, Deputy.
Next, we have Patty Giggins.
Yes, thanks for listening to us today. I think it's an important opportunity for the board to hear from the practitioners. I'm Patty Giggins. I'm the executive director at Peace Over Violence, and we are in a very strong collaboration with the Downtown Women's Center. And you've heard we're all here out in force today because of the devastating impact that these cuts are going to have on our agencies. And part of, I think, I do want to start with an appreciation though. I heard that in the beginning you said that CalVCB is going to be participating in Denim Day, which is April 24th. And I just want to let you know that Peace Over Violence started Denim Day back in 1999. I'm the founder of Denim Day, and it's the longest running sexual violence prevention education campaign in the country. It is now national and international. And through that, we also have opportunities to reach more victims of trauma, of sexual assault, while we educate to prevent. So I just wanted to share and appreciate you're going to be wearing your jeans on Denim Day. But continue about the situation that we find ourselves in. It disturbs me that we are being very passive about the handcuffs that statutes impose on us. I'm not hearing or I'm not seeing, and I'm hoping that can change, that we can engage with the legislature to improve and expand this model. All the evidence is in that it is important and that it's a combination of nonprofit agencies and government. And it's something that's gone on for 10 years now and has proven really helping. I've been involved for 40 years in California at my agency working with victim survivors. And I remember when no one could spell trauma, or trauma-informed did not exist. And victims were pretty much, everybody's out, trying to figure it out on their own. So, but we've moved the needle in California. So I am concerned that at this particular time, whether it's by statute or by whatever means, that we would, that the board would include and expand to 2 more TRCs while defunding the others by 50%. Again, we are all skillful fundraisers here. We know that we have to apply. We know that there's tremendous competition. This is our lives. This is the way we have to run our agencies. And we do this because we advocate for communities and we advocate for victim survivors. But the fact that we would expand now while there's cuts, plus there's a huge cut going on with VOCA around the country, that federal money that goes to each state. California gets the largest amount because we have the most people, and the cuts are going to be devastating. And this is VOCA, Victim of Crime Act funding. So at this time, we're here because we need to hold on to every single dollar we can to get through these tough times. Hopefully these tough times will not be here forever. We've all seen waves of ups and downs, right? So I guess I'm just here to lend my voice with all of my colleagues. And this is no disrespect to the other 2 folks who I'm sure are deserving. But it just doesn't make sense to me. And you could say it's statute, but it still doesn't make sense that we would expand when we are being defunded. Appreciate the time to add my voice to everyone else's, and thank you for listening.
Thank you, Ms. Giggins.
Tina Rodriguez, please go ahead.
Thank you. I want to start off by expressing my appreciation to you as well as board president of the National Sexual Assault Committee. Valor, I appreciate you honoring Denim Day. That is huge for us. And then just also want to share that I understand limitations and funding streams and how to sometimes deliver them. There's sometimes tough positions to be in. It just reminds me so much right now what we're dealing with and talking about how to project funding for other crime streams right now, crime victim streams right now. Do we go based off calls that are submitted to 911, or do we look at prior reports, and would that eliminate those that don't report? That's a big discussion going on right now in other conversations. It's kind of similar to this in different ways. I understand what cannot be done, but just want to hold myself accountable to coming to conversations and emphasizing what can be done. We know that this crisis that California is in regards to how everything affects mental health. I simply think of California and I think of the housing crisis right now. This model specifically allows for clinicians to go on the ground, to go meet victims where they're at, whether they're homeless in shelters and substance abuse centers. There's a lot of agencies, I'm in the Central Valley, that will not allow that. And so that's my biggest concern, is that those that are rehoused and homeless at the greatest need, what happens to them with this impact right here? So what can CalVCB do? Will you be, working to expedite other claims for other organizations that possibly offer that. I'm just thinking of solutions because that's where I choose to stay planted. Nonetheless, I want to thank you for your due diligence. I understand this is a difficult position to be in. Thank you.
Thank you, Ms. Rodriguez. Is there any other public comment or discussion before we take a vote? Yes.
Thanks, Chair. And I just wanted to take a minute, or should we take the last public comment here? Looks like. Oh, that's not it. Oh, yeah. Let me just say that this conversation, first off, is extremely illuminating, and I really appreciate everyone showing up to advocate on behalf of your organizations and the critical work that you do. At a minimum, it's really valuable to hear from your voices and to hear sort of a little more detail and color to the work that you do that gets funded through these grants. And we really appreciate that. I personally really appreciate that opportunity to hear that. And I think, we're just in a very difficult situation. I mean, statutory requirements aside, it's just not enough money, and I don't think any of us are happy about this situation in terms of, we wish there were enough dollars to go around, and they're not. And it occurs to me that certainly Cal VCB, it appears, correct me if I'm wrong, couldn't fully fund any of the 7 existing applications fully if we did remove those 2 new ones. So obviously we result in a little more funding going around, but it wouldn't solve the problem. And I think that speaks to the problem itself, which is simply that there's just not enough funds, and we are in a lean budget year, and unfortunately sometimes we have to take what we can get, what we're given in the budget. So I wanted to express my gratitude though for everybody speaking up on behalf of your organizations. Again, it's very illuminating, and I appreciate you taking the time. Thank you, Member Johnson. And Member Becton?
Yes, thank you, Chair. I want to certainly appreciate all of those who've taken the time to give comments to us today. They've certainly been very helpful and provided a tremendous amount of food for thought. I think there are 2 things. I know that we have a motion on the floor, so we will have to vote, but I would seek 2 pieces of information. One would be a clarification on the statutory limitations that were mentioned in terms of being able to consider funding the existing TRCs before we fund new and additional ones. That's number 1. And then number 2, I really appreciate all of the work that has really gone into thinking about, how to best spread around these very, very limited funds. But I do think it would be helpful as well to see an analysis, like at one point on page 3 of our report, it indicates that if the funds were allocated differently, only 6 of the 9 TRCs could be fully funded. And I wondered if we could see an analysis, for example, if the 2 new ones were not funded, if that were statutorily possible, how that would really affect the funding for the existing TRCs. I think we need that piece of information because the request of us is to take the funds and distribute the funds to only the existing TRCs and not fund the new ones. But it is not clear to me how that would really be helpful to the existing TRCs. Would it result in a significant amount of additional funding or just a slight difference? And so I would like to have clarification on those 2 points if we could. One being the statutory interpretation in terms of our limitations, and then 2, what it would look like if we were only to fund the existing, if we could do that. Thank you.
Deputy, thank you, Member Becton. Either Deputy Cardenas or perhaps Council. My understanding is that the statute establishes a competitive grant program, and so it's required to score them essentially and to award funds in accordance with the strength of the application. And with respect to the second question, it looks like it's around $2 million that are going to either new or previous TRCs, which distributed among the 7 existing ones, roughly 300,000 a piece if we were to be just divvied up evenly, which is not even close to their full request. But I'm sorry to take up your space here, either Deputy Cardenas or Council.
I see Kim has the statute right in front of her, but based on my memory, the statute says that we must distribute the funding using a well-defined grant process, and the well-defined grant process involves scoring the applications against the statutory criteria, which the statute has 6 different requirements of TRCs. And so again, the notice of funds available makes it very clear that we will be scoring applicants based on their ability to illustrate to us through that grant process their ability to meet those statutory requirements. And so that the scoring is objective. It's done by people who are familiar with the Trauma Recovery Center services and victim services within CalVCB. And I don't know if you have anything you want to add to that, Kim.
No, I thought you did a good job. Thanks. But specifically, we're talking about Government Code Section 13963.1, which talks about the grants to the trauma recovery centers and selects the board as the entity responsible for administering the grant program. And as Katie said, it specifically says that we shall that the site shall be selected by the board through a well-defined selection process that takes into consideration the rate of crime and geographic distribution to serve the greatest number of victims or potential victims of crime. So, as Katie indicated, we put out a notice of funds available with the criteria, and that criteria includes the scoring criteria by which those organizations will be judged. So, the statute makes it clear that it is CalVCB's responsibility. It also makes it clear that CalVCB shall have a fair and impartial process in determining who should receive the grant funds.
Can I ask a follow-up question on that, and to Member Becton's question? Where there does seem to be flexibility is in the funding formula that's resulting from the different tiers of evaluation, right? So staff have recommended here 100% funding for tier 1, and was it 76% for tier 2 and 60% for tier 3, and that's sort of a choice related to the amount of funds available. So there is technically flexibility, but the resulting situation, I presume, would be that if we chose to say 100% fund down the list, tier 1, tier 2, and then into tier 3, that it would still result then in a one of the new centers receiving full funding. Is that correct, as I understand it?
That is correct. The top scoring TRC is the new TRC, and so if using the grant scores from the notice of funds available process, that TRC should be funded as it is in tier 1. It's the only TRC in tier 1.
It's helpful. Thank you. Looks like we have a couple of additional public.
Yes, we can take our couple of additional public comments. We'll start with Dr. Castro Rodriguez, please.
Thank you very much for the opportunity to speak. I just want to say that the author of the statute is the founder of the Trauma Recovery Centers and the National Trauma Recovery Center Alliance, Dr. Alicia Busolari, who could not be here today because she has a family emergency. But she specifically put language in the statute to allow for flexibility in making these kinds of decisions. We've offered in the past and continue to be available and offer to sit down and discuss the statute and find a way to do the distribution of funds in a way that allows the model to be successful. Yes, it would only be $2 million if we didn't fund new trauma recovery centers, but that $2 million would allow many of the TRCs to continue providing the services that they are with some fidelity while they try to find additional resources. And the idea of expanding services for survivors is really being lost here, because yes, there's new TRCs that are going to be opening, but think of all the survivors that are going to, the services are going to be pulled away from them in existing agencies who already have the relationships, who already have the connections, who are already serving survivors and families. And so we will not have a net gain in the number of survivors served. We're going to have a net loss, even given the decrease in funding. We all understand the crisis that we're in around funds and budget. We're not asking for the board to come up with money that's not available. We're just asking to be strategic about the existing services and the existing resources available to survivors, and how we continue those as we work as a group to increase funding and opportunities at the federal level, so that TRCs have more opportunities to apply for resources that specifically fund this kind of work. There really are no other funding sources in California that fund this kind of work. And so we have to be very strategic with the dollars that we do have available and not lose services. Thank you.
Thank you, Doctor. And Ms. Wiegall.
Thank you again for the opportunity to speak briefly. And I just wanted to add that in our work with trauma recovery centers in other states outside of California, we do also work with government funders who are funding grant programs for trauma recovery centers, and have examples to share. We'd be happy to work with CalVCB, and also would be happy to convene even a meeting of grant funders for TRCs from other states to also contribute to the conversation around a well-defined grant program for funding trauma recovery centers, because there are examples in other states also of giving some priority points, for example, to existing TRCs, since we know the impact that it has on communities to pull these services away from established programs, and then use the funds to start up new programs, which take quite some time to build up and implement in other communities. And again, we understand the pressure to want to increase access, but we also have to be realistic, I think, when we look at the results of the impact of those kinds of funding decisions. And also just to echo, I think what has also been said around the potential for changing the grant management process by including TRC model content experts potentially, and survivors of violent crime, and really being able to evaluate grant proposals. So thank you very much for the opportunity to speak.
Thank you, Ms. Wiegall.
Chair, if I may, I'd reference again the Government Code Section 13963.1, where it states in subsection D, the board may award consecutive grants to a trauma recovery center to prevent a lapse in funding. There is no preference provided in statute, and then again, the competitive process is as outlined as previously stated.
Thank you, Council. And I want to thank Council and Deputy Cardenas and all the commenters on this item. It's obviously extremely important to the community. I want to thank you also for the extremely important work that you're doing. I don't think any of us are happy about not being able to fund you all fully. It's in no way a recognition that what you're doing isn't really vital to communities and to crime victims. That in mind, Council, will you please call the roll?
The pending motion before the board is approval of the Trauma Recovery Center grant awards as recommended, and the authority for staff to increase or decrease the awards as necessary to reflect the funds available following release of the governor's revised budget in May. Member Becton.
Aye.
Member Johnson.
Aye.
Chair Ravel.
Aye.
Motion passes.
Can I make an additional comment on this?
Of course.
I do think that the lesson I take away from this is that it would be useful in the future to revisit this conversation next year, or the next time the grant cycle comes around, so that the community is engaged deeply. And I'm assuming the staff already does this, so I don't mean to make intimations that it doesn't happen, but just make sure that the conversation between staff and the applicants and recipients is such that there's a sort of a robust understanding of how best to have the most valuable outcome, right? The community knows what's best in terms of how these funds get distributed, and I think that that having that reflected in the next cycle will be good. And like I said, I don't mean to intimate that doesn't already happen. I'm aware that those are very robust conversations already. I just think it would be good to have that sort of demonstrated.
Yeah, thank you for that. I think I just want to reiterate, I think, and I've said during my previous executive officer remarks that when we issue the notice of available funds, we spread that far and wide. That is a very, defined process, the grant process. And of course, the state's fiscal situation that we find ourselves in is one that is perhaps not always known when we issue the notice of available funds. It develops with time with the release of the governor's January budget and also with the May revision. So, we encourage every TRC, existing, new, to look at the requirements, write a grant proposal that will allow them to receive a good score, so that we can continue to fund what we can. But obviously, these are, as you all said, very challenging times. There's not enough money to go around, and we are following a defined process to the best of our ability. But yes, we'll continue, of course, to always work with our partners in the community.
Thank you.
Thank you. We actually have another public comment. Patty Giggins.
Yeah, thank you. Clearly, we're very disappointed, and we're in a very critical period. We're in a crisis period, and so I just want to add to the thinking moving forward. When you say that the community knows best, I think that's true, but we have to make sure that the community is included. And sometimes the structure of the way things are set up, that doesn't happen. It happens after the fact. But we're in a crisis period now with these cuts from CalVCB, from the cuts from VOCA. Right now, the situation for victims in California is looking dire and very bleak. So I think it's important that to use this crisis to look at how to restructure things, look at the statutes, right? Look at how the board gets information. There are other boards and commissions who actually include expert witnesses, practitioners, survivors. So I just want to say that on behalf of all of us who are certainly disappointed. We know we have to follow the rules, but we don't like having the rules keep repeating. We have to do this because of the rules. The rules. What that says to me and all of us, because we're advocates, is no, maybe we need to change the rules. So yeah. Thank you for your time today, and thank you for listening to all of us. I know it's not easy to have people come and plead and beg and complain, but we really do appreciate it.
Thank you, Ms. Giggins.
We have Edward Buchanan. If you can go ahead, please.
Hi, yeah, I'll be real quick. So, yeah, I just wanted to say I'm Ed Buchanan, Director of Clinical Services with Boston. We're a brand new TRC that's in development. And so we, will have like weekly meetings about, just the status of the development of our program and looking at our budget and, how we have to finance certain positions. And it's been extremely difficult because of the lack of funding, the limited amount of funding we have. And this is like really just hard news for me, just being in the midst of developing a new TRC. And it's really in the heart of an area that's in dire need, a very traumatized area that's in dire need of this center. And so, we have been, as an agency, relying on UCSF, to support with just the development of our program. And so I just can't imagine the impact that these budget modifications or cuts are going to, have on all of us across the board. And so just wanted to share that even just during the midst of this meeting, you know, we got some referrals. But because of, you know, our limitations with our budgeting, you know, we just have to really be careful with how we're even, you know, hiring staff and whatnot. So yeah, this is just really hard news, and hopefully some things change, because we really do need as much funding across the board as possible to service the community.
Thank you, Mr. Buchanan.
No more comments. We will move to item 8, which is the Penal Code Section 4900 claim of Truman Simon, which will be presented by Chief Counsel Kim Gutierrez.
On March 23rd, 2022, Truman Simon filed an application with the California Victim Compensation Board as an erroneously convicted felon. That application was based on his 2018 convictions as an aider and abettor to assault with a firearm and criminal threats. The claim seeks $154,560 for 1,104 days of alleged imprisonment. The Attorney General objected to the claim, arguing the evidence fails to prove Mr. Simon's innocence. As explained in detail in the proposed decision, the claim is recommended for denial, as Mr. Simon has failed to meet his burden of showing by a preponderance of the evidence that he is innocent of the challenged convictions as required by Penal Code Section 4900, Subdivision A. Throughout these proceedings, Mr. Simon represented himself. The Office of the Attorney General is represented by Deputy Attorney General Dina Petroshenko.
Thank you, Counsel. Is Mr. Simon in the meeting? Mr. Simon doesn't appear to be in the meeting, so we'll hear from Ms. Petroshenko from the Attorney General's office.
Thank you to the board for the opportunity to be present. I do request that the board adopt the hearing officer's proposed decision. Mr. Simon did submit a letter objecting to the proposed decision. I'd ask that the board note that he continues to maintain same argument, which is that his Court of Appeal, the reversal of his conviction by the Court of Appeal amounted to a finding of factual innocence, which is not an accurate statement of what occurred. And based on his failure to prove his actual innocence, the board should adopt the proposed decision. Thank you.
Thank you, Counsel. Is there any discussion on this item by the board? Well, actually, Counsel, if I could ask, it seems this is at least potentially a close case. I think that ultimately it comes down to the burden of proof. I mean, there doesn't seem to be a lot of affirmative evidence of the crime, in the sense that it's not clear from what we've heard that Mr. Simon saw the weapon, or that we don't know whether the weapon was loaded, and the timing seems a little unusual too. We don't know whether he continued to threaten or talk to the victim aggressively after the weapon was pulled. On the other hand, you've noted that although there was a reversal on appeal, there was not an affirmative finding of factual innocence after the case was dismissed. And you know, it's also not clear what sort of evidence Mr. Simon has brought forward that he didn't see the gun, or that he didn't escalate the conversation. So I'd like to hear a bit from you on that point, and then we can have Ms. Becton's comments and questions.
Yes. I think this just comes down to the matter of Mr. Simon failing to meet his burden. While I concede that this is a circumstantial case, there's inferences to be made from the witness's testimony and from the timing of the events, from when Mr. Simon and the other individuals were first stopped by law enforcement with no gun in hand, and within an hour they were at the victim's front door with a gun in hand. There are inferences to be made about what Mr. Simon knew, and with those reasonable inferences and Mr. Simon's failure to make his case affirmatively, the only result that the board can reach is that he's failed to prove his factual innocence.
Thank you, Counsel. Member Becton.
Thank you, Chair. I just wanted to ask for a clarification, please, of the language from the Court of Appeal on page 10, specifically at, because the language consistent in the recommendation is that there's insufficient evidence, that the Court of Appeal said that the evidence was insufficient. But on page 10, line 4, the statement is that the appellate court found that there was no evidence that he, shared the gunman's criminal purpose, that he knew of the firearm's presence or intended to aid and abet. And I think because this is a relatively close call and we are talking about circumstantial evidence and making certain inferences, I think it's important for us, or for me, to really clarify what was found by the Court of Appeal, if it was insufficient versus no evidence. Can we have a clarification, please?
Sure. And just so I'm sure, you're talking about page 10 of the proposed decision or the opinion?
Of the proposed decision. On page 10, line 4, the wording is that the appellate court found no evidence.
Or so the proposed decision accurately reflects the Court of Appeals wording on page 4 of the opinion. The holding is that there is insufficient evidence to prove the aider and abetter theory for 2 reasons. And it says, quote, there is no evidence he, being Mr. Simon, shared the gunman's criminal purpose. Does that answer the question of what the Court of Appeals opinion says?
Yeah, I mean, it's because words matter, right? And it's a little difficult to, on the one hand, say that the evidence is insufficient, and on the other hand, to say that the Court of Appeal said that there's no evidence. I mean, there's a significant difference between the two. And given that the burden in this proceeding is by a preponderance, it would be difficult to find that burden hasn't been met if the Court of Appeal, having reviewed the entire record, indicates that there's no evidence.
Right. So what the Court of Appeal referred to in its statement, no evidence, is if you look at page 5 of the opinion, for example, no evidence that Mr. Simon owned the firearm or possessed it at some point prior to or after the crimes. But what the board can do and what the court can also do is make reasonable inferences from the circumstantial evidence that is available, which is the short amount of time in which the 3 men obtained the gun together and presented themselves at the victim's door. The reasonable inference being that Mr. Simon would have been aware of the gun's presence, since it wasn't in anyone's possession at the beginning, at 2:00 when they were searched by the police. So maybe to be more pointed about it, yes, there is no affirmative evidence, but we can draw inferences from the circumstantial evidence as it is.
Counsel, I think this is a point that's really important to clarify. If I'm understanding the burden correctly, the burden is, the standard is preponderance of the evidence, but the burden is on the claimant to bring forward some affirmative evidence that he didn't do any of those things. And so I think the consequence of that, if I'm understanding correctly, is that he has the burden to defeat those inferences that you're describing?
He has the burden to show his innocence, and it's kind of two-pronged here. He's failed to present any kind of evidence, plus the evidence that the Attorney General has put forward raises these inferences in the absence, and so what you have is nothing and then inferences, plus Mr. Simon has the burden, which he has not met.
Thank you, Counsel. Is there further comment or questions from the board?
I would only say that I agree with both the chair and member that this was a tough one to sort of adjudicate in my mind personally, and and I think that speaks to the complexity of it and the standard that's before us about the burden of proof. And I found myself going down a rabbit hole of well, what would that proof look like? How can you prove something that what evidence could he put forward? That he didn't know the gun was there during this process, right? It's always going to be based on his testimony, is how it felt to me, and I think that's put me in a tough position thinking about this. I don't have a resolution on that other than to say that I sympathize with the other board members here and on the case itself. Thank you. Member Becton.
Yeah, thank you. I guess what I'm struggling with is the drawing the inferences based on circumstantial evidence, and I think, and clarify, please, if I'm incorrect, that Mr. Simon is entitled to rely, at least in significant part, on the appellate decision. And I find it a bit contradictory for me to read that the appellate court found that there was no evidence that Mr. Simon knew about the firearms presence, or any evidence that he intended to aid and abet, or that he knew of the gunman's criminal purpose, and then at the same time make inferences about what he did know based on my interpretation of the circumstantial evidence. So to me, I feel like it's a bit contradictory for me to make those inferences, given that the Court of Appeal has already made that finding that there is no evidence that he knew about the gun's purpose. I'm sorry, its presence. So that I just wanted to point that out. And if I'm incorrect in reading that, please clarify for me. But that's my difficulty here, is drawing those inferences when the Court of Appeal has already made such a record that there is no evidence.
Yeah, I suppose, sorry about that. At the end of the day, for me, this is a really hard case, but at the end of the day, for me, what's persuasive is when you consider that it's the claimant that has the burden of showing that he didn't commit the crime, and the only evidence that he has brought forward affirmatively is just a blanket denial that it happened, essentially, which seems clearly contradicted by the record. If he had said, I didn't know there was a gun, I didn't see a gun, but as I understand it, he didn't say that. And do I have that right, Counsel?
That's correct. Mr. Simon's, first, Mr. Simon has solely relied on the appellate decision, but he also did not wish to proceed with the hearing or testify or provide evidence.
Yeah.
At all.
Yeah, to me, it would have been a much closer question if he'd testified and said, I didn't know there was a gun and I didn't see it there. I was there, but I didn't know there was a gun, and I had no intention of threatening the victim. But sorry, Member Johnson.
No, I didn't mean to interrupt. I guess, as I understand it, right, because the appellate court says there is no evidence, that doesn't change the fact that the burden is there must be evidence provided that he did not commit the crime. It doesn't change that burden, correct? And so your point, Chair, is that if there had been a sworn statement that would carry some weight here, one of the questions I had when I was reviewing this is, it says that both the AG's office and the applicant claimant chose to waive the hearing. How does that process go? Is it you know, did the AG's office request a hearing and the claimant says, no, I don't want to do that? Or how does that process go? And I guess the question is, would it, in my mind, I wonder if it would have changed things if that hearing had taken place rather than the written testimony, relying on the written testimony.
I can provide some of that information, and I think this was years ago, and I'm trying to recall because there have been a number of cases. Once the parties submit their briefings, the hearing officer sends notice to both parties simultaneously, asking the parties to confer on whether the parties wish to have a hearing and provide further briefing, and a date by which the parties are to notify the hearing officer of the decision. If I recall, and I could take a couple of minutes to go back through my emails to look. I believe this was, I contacted Mr. Simon to inquire what his answer was to the hearing officer's questions. Did he wish to have a hearing? Did he have evidence to present at the hearing? And then I said, if he did not have anything, I also would not present any evidence. And I believe it was I that responded to the hearing officer summarizing the conversation Mr. Simon and I had. And that is how we came to not have a hearing.
To clarify, the custom and practice is that the hearing officer will ask both parties. We do ask them to confer regarding whether or not they want it, and also to provide us with selected dates. If either party had requested a hearing, the hearing officer would have held a hearing.
Yes.
And in your communications, Ms. Petroshenko, with Mr. Simon, presumably when you alerted the hearing officer that he did not wish to have a hearing, you would have CC'd him on that communication. Yes?
Right, and actually he responded confirming that my representation of my conversation with him was accurate, in which he denied or declined to have a hearing.
Thank you. Yes, Member Johnson.
I just want to clarify our potential courses of action here from the chair. Can you walk us through that, please?
We put that to the chair, but I'd be happy to.
I was looking past the chair, but yeah.
Okay, pursuant to the regulations that govern these types of hearings, the board may take any of the following actions concerning the proposed decision. Adopt the proposed decision in whole or in part, reject the proposed decision in whole or in part, defer decision and request the hearing officer to address specific issues or provide additional information. If the board rejects the proposed decision in whole or in part, it may take any of the following actions. Decide the case itself after reviewing the record, including a transcript of the hearing. Decide the case itself based upon a statement of facts agreed to by the parties. Decide the case itself by conducting a hearing to take additional evidence or argument. Order the hearing officer to take additional evidence or argument, or order the hearing officer to address specific issues in the proposed decision.
And if I may, I did find my correspondence with Mr. Simon, so I could provide the board exactly the conversation he and I had by email.
Please.
Okay, so we were notified by Ms. Simpton on February 27th to meet and confer, or to confer with each other. And I did that by phone call with Mr. Simon. And what I wrote in summary to the board, to the hearing officer with Mr. Simon included on the email was this. I said, I gave him my name and stated that I was an attorney for the Attorney General's office and the person who filed the response letter regarding his claim. I confirmed that he received the email on February 24th, 2023, with the links to the Attorney General's response letter and exhibits. Mr. Simon stated he had not yet downloaded the documents, but had access to the email and links. I asked whether Mr. Simon was willing and prepared to discuss the questions you, being Ms. Simpton, posed in your email, and he stated he was. I explained to Mr. Simon that I was prepared to waive a hearing because I had no additional evidence or witnesses to present. I told Mr. Simon that it was his right to have a hearing to meet his burden. I asked him whether he had witnesses or evidence to present regarding his claim. Mr. Simon stated that he also had no additional evidence or witnesses to present and was willing to submit on his written materials previously submitted. Then I wrote, because both parties waived, there is no need for pre-hearing briefs. I asked Mr. Simon if he would like for me to submit an email response on behalf of both of us, and he agreed. I stated I would include him on this email so that he may correct any inaccuracies. Mr. Simon responded to that email to everyone, including the board, agreeing that it was an accurate statement.
Thank you, Council. Is there any further questions, comments? Yes, Member Johnson.
I don't have one at the moment. I was just thinking through our options.
Very good. Very good. Well, at this point, I'll call for a motion to approve. We have a motion on this item. If, well, sorry, I'll give you a minute. Okay. All right. Well, I'll move to approve it. Do I have a second?
Is there any public comment on this item via Zoom here in Sacramento or at the Martinez location? Seeing none?
Okay, Council.
Well,
We don't have a second.
we don't have a second. So do we have an alternate motion?
Yes.
So I'm just trying to understand our options. So one option here would be to send this back to the hearing officer for further evaluation. Is that correct?
That's correct. Yes.
Okay. With that in mind, I think I will make the motion along those lines, and I'm not sure the exact terminology here, but would be to send this back to the hearing officer for additional evaluation on the case.
I will second that.
Chair, if I may, it would be helpful in referring it back to the hearing officer to understand exactly what specific issues, consistent with the regulation for referring it back to the hearing officer, are to be addressed by the hearing officer upon remand.
And you're more familiar with the statute than I am. What would be consistent with the statute so that I understand whether I'm within or without the guidelines or outside of the guidelines?
The statute doesn't talk about what specific issues. You can refer back to the hearing officer. So for instance, I think it would be helpful to the hearing officer to know, would you like to see more evidence and or argument or information regarding the burden of proof? Would you like to see more information and or argument regarding the binding or non-binding effect of the appellate court decision? Those are examples of specific issues that you may ask the hearing officer to address, and not limited to just those.
See, well, I think, I would ask, looks like I was just going to ask Member Becton to weigh in on this as well. So why don't we have her weigh in and then I can do follow up.
Member Becton.
Thank you. I just wanted the hearing officer to clarify the issue that I was raising earlier, because the language that is used in the proposed decision and conclusion is inconsistent. Either the appellate court found that there was no evidence, or they found insufficient evidence. And I think the difference makes a huge difference for me. Given the close call that everyone has mentioned in this case, given that his co-defendants, including the person who's actually had the gun, according to all of the information provided, were acquitted by the jury. So I think if the appellate court said there's no evidence, then I think that weighs heavily for me. So I really need that clarification. And it should be clear in the proposal whether the wording should be no evidence or the wording is insufficient, because they mean two very different things.
Yeah, and to add on that, I think more focus on the burden of proof and precisely what that means in this case, recognizing the effect of the appellate decision, and with the record that we have. Yeah, as I said, I was prepared to approve it, but I think it was a close question for me without that clarification that he hadn't put any forward any affirmative evidence that he wasn't aware of the gun. At this point, I assume the record's closed and it's not possible to supplement it. But that would be helpful to know too.
Actually, under the regulation, the hearing officer can reopen the record if necessary to take additional evidence.
That's true. And Mr. Simon has elected not to be present here today or participate in a hearing with the hearing officer. I understand the questions that are being raised. I think the lens that we have to look at this Court of Appeal opinion through is the legal issue that was raised, which is sufficiency of the evidence. And that was the standard of review that the Court of Appeal was applying. So, and that is how that Court of Appeal addresses the issue a number of times, whether the evidence was sufficient, and it concludes saying that there is no reasonable, credible, and solid evidence, which is the definition of what sufficiency of the evidence is. So when we read phrases like no evidence or there is no evidence, it's in the light of the standard of review that the Court of Appeal was applying, which is whether there's solid, let me repeat that one more time, solid, reasonable, credible, and solid evidence that amounts to meets a burden high enough to sustain a guilty verdict. I understand, yes, I do not discount that they use the phrase there is no evidence, but that is in light of meeting this legal claim of insufficiency of the evidence. So there was no factual innocence finding. There can be no factual innocence finding.
Yeah, and there was not a factual innocence finding when it was remanded to the Superior Court and dismissed. Okay, well we'll take it back, and after the hearing officer supplements the opinion,
We need to vote on that motion.
we do. Yes, of course.
Just one last question on this. I appreciate your patience. So you had mentioned that they can, there is an option to reopen the file on this, correct?
In the hearing officer's discretion, if necessary, to address the remanded issues.
Perfect. That was the question. I mean, it's something that struck me is that both myself and the chair indicated, that some elements of this that sort of could have tipped the scales for us, and I think that's an important statement. So I just want to make sure there is that option should they choose under the hearing officer's discretion.
Is there further discussion on this item before we take a vote on the revised motion? Council, please call the roll.
The motion before the board is the remand of the proposed decision in the Truman Simon PC 4900 matter. Member Becton.
Aye.
Member Johnson.
Aye.
Chair Ravel.
Aye.
Motion passes.
Thank you. We will now move to item 9, which is the Penal Code Section 4900 of Maurice Caldwell, which will be presented by Chief Counsel Kim Gauthier.
On March 25th of 2013, Maurice Caldwell filed an application with the California Victim Compensation Board as an erroneously convicted felon. That application is based on his 1991 convictions for murder, attempted murder, and discharging a firearm into an occupied vehicle, which convictions were vacated in 2010 pursuant to a grant of habeas corpus, and the charges were dismissed in 2011. This matter includes a long procedural history as detailed in the proposed decision. As there was no objection filed by the Office of the Attorney General, compensation is automatic under Penal Code Section 4900, subsection B. Accordingly, the proposed decision recommends compensation in the amount of $1,049,160, which represents $140 per day for each of the 7,494 days Mr. Caldwell was wrongfully imprisoned. Throughout these proceedings, Mr. Caldwell has been represented by the law firms of Gross and Belsky and Quadra and Cole. Today, the Office of the Attorney General is, I believe, represented by Deputy Attorney General Sharon Loeffner.
Thank you, Counsel. We'll hear first from Counsel for Mr. Caldwell.
Yes, thank you. Thank you, Chair. This is Terry Gross from Gross and Belsky on behalf of Maurice Caldwell. We obviously support the recommended decision and request that the board approve it. As it's just been read and as the proposed decision said, that under section Penal Code Section 4900, subsection B, the board is mandated to approve this. Based on the evidence that's been presented so far. So we're here for any questions, but we have no further argument.
Thank you, Mr. Gross. We'll hear now from Ms. Loeffner of the Attorney General's office. Actually, excuse me, is Mr. Caldwell present? I didn't see him in the list, but we want to make sure he has an opportunity to address the board if he'd like to.
He's not present right now.
Thank you, Mr. Gross. Okay, Ms. Loeffner.
We have no comment.
Thank you. Is there any discussion on this item by the board? Do I have a motion on item 9?
Move to approve the hearing officer's recommendation in item 9.
Call for a second.
I second.
Is there any public comment on this item via Zoom here in Sacramento or at the Martinez location?
Ms. Petros, I see you have your hand up.
Yes, Margaret Petros, Executive Director with Mothers Against Murder. I want to tell the honorable board members that you are doing a great job with the 4,900 claims. You are being thoughtful. You're giving a chance to the claimants to ask questions. Justice is being done, due process is being done, but you don't do the same for crime victims on their victim compensation claims when they're denied. And I've expressed that concern over and over. So I want you again to think about giving victims opportunities at these meetings to whose claims are being denied, because they also have the burden of proof to answer your questions. But you're going into closed sessions and making a decision based on staff recommendations that have not even been shared with the victims or their advocates. Our agency have a writ of mandate going on in court on this issue now, but we've really tried very hard. I've tried hard to resolve it with the staff and you. So please keep that in mind and make the necessary change. Thank you.
Thank you, Ms. Petros. I obviously can't talk about what's going on in closed session, but I do want to assure you that we take all of the recommendations seriously and that we scrutinize them all and often have vigorous discussion about them. Okay, Counsel, please call the roll.
The motion before the board is adoption of the hearing officer's proposed decision in the Penal Code Section 4900 matter of Maurice Caldwell. Member Becton.
Aye.
Member Johnson.
Aye.
Chair Ravel.
Aye.
Motion passes.
Thank you. Item 10 is the Penal Code Section 4900 claim of Miguel Solorio, which will be presented by Chief Counsel Kim Gauthier.
On January 9th of 2024, Mr. Solorio filed an application with the California Victim Compensation Board as an erroneously convicted felon. That application was supplemented on January 23rd and February 22nd. The application is based on Mr. Solorio's 2000 convictions for first-degree murder, attempted first-degree murder, 6 counts of assault with a firearm, and other related charges. Those convictions were vacated in November 2023 pursuant to a grant of habeas corpus. In December 2023, the court granted the motion for a finding of factual innocence pursuant to Penal Code Section 1485.55. As mandated by the court order and pursuant to Penal Code Section 1485.55, the proposed decision recommends compensation in the amount of $1,260,420, which represents $140 per day for each of the 9,003 days that Mr. Solorio was wrongfully imprisoned. Mr. Solorio is represented in this proceeding by Sarah Pace of the Northern California Innocence Project, and the Office of the Attorney General is represented by Deputy Attorney General Dina Petroshenko.
Thank you, counsel. We'll hear first from counsel for Mr. Solorio.
Thank you so much. My name is Sarah Pace, and like that was stated, I'm a lawyer with the Northern California Innocence Project. I am joined here by my client, Miguel Solorio, and his wife, Sylvia. I had the privilege of working on Miguel's exoneration, along with Paige Canib, Ellen Eggers, and a few others at the Northern California Innocence Project. It is a momentous day today because the board's proposed decision. It's also momentous because it is the beginning of the Innocence Network Conference. So we are actually zooming in here from New Orleans. Hundreds of innocence advocates and exonerees, including Miguel, have gathered in New Orleans to learn from each other and celebrate freedom. What a powerful time to also get to celebrate this board's proposed decision to compensate Miguel for his 25 years of wrongful incarceration, 25 years of time taken from him. I want to thank the Compensation Board for their consideration of Miguel's case and their proposed decision today. I am grateful that the legislative reforms designed to make the compensation process less arduous for those who have been wrongfully convicted came into full effect for Miguel, when I know it has not always been as easy for many other folks before him. Maurice Caldwell was actually also a Northern California Innocence Project client. And it's also a momentous day for him to finally get the compensation that he so deserves. So I wish him congratulations as well, and to his attorneys. The compensation that Miguel will receive through this agency will undoubtedly help him and his family. His wife, Sylvia Solorio, who is here today, was Miguel's main alibi witness at his trial. She married him after he was convicted and stayed by his side day after day, week after week, month after month, and year after year he was in prison. 25 years they fought together for him to come home, to get the system to finally realize it had made a devastating mistake. And on November 13th, 2023, Miguel and Sylvia finally won his freedom. Miguel immigrated to the US from Mexico with his family when he was young. Living in poverty for part of his childhood, he dreamed of achieving the American dream. Miguel and Sylvia were both college students the day that Miguel's life was taken from him, when he was arrested and eventually convicted for a crime he had nothing to do with. Miguel was studying business and always wanted to work with computers at an office. He wanted to own a house, have a family, have a commute, attend work meetings, and dress up nice for work. Things that many of us here today have. Things that many of us take for granted. The compensation from the California VCB cannot undo the 25 years Miguel spent sitting in prison when he should have been realizing his potential and going after his dream. It cannot undo the 25 years he spent separated from his family, missing countless birthdays, holidays, funerals, births, and family dinners. It can't undo the 25 years he spent missing out on the big and simple pleasures of life, bike rides along the ocean, traveling abroad, car rides with his wife, and sunsets at the beach. But it can and will help him and Sylvia make the most of the many years to come. Miguel and Sylvia, congratulations. You deserve this and so much more.
Thank you, Ms. Pace. Mr. Solorio, would you like to address the board?
Yes. Good afternoon, Your Honor. Good afternoon, board members. I'd just like to show my gratitude by saying thank you from the bottom of my heart for everything. Say thank you.
Thank you, Mr. Solorio. We'll hear now from Ms. Petroshenko from the Attorney General's office.
There is no objection to the compensation award.
Thank you, counsel. Do I have a motion on item 10? Actually, excuse me, we have to have discussion first. Is there any discussion on this item by the board? Okay. I call for a motion on item 10.
I move to adopt the hearing officer's proposed decision in the Penal Code Section 4900 matter of Maurice Solorio.
Miguel.
I second that motion.
Is there any public comment on this item via Zoom here in Sacramento or at the Martinez location? Seeing none.
Council, please call the roll.
The motion before the board is adoption of the hearing officer's proposed decision in the Penal Code Section 4900 matter of Miguel Solorio. Member Becton.
Aye.
Member Johnson.
Aye.
Chair Ravel.
Aye.
Motion passes.
Thank you. Thank you.
Thank you, counsel, for your advocacy. The board will now convene into closed session under Government Code Section 11126 sub 3 to discuss numbers 1A through 61 of the Victim Compensation Program.
Thank you.
The board is reconvening into open session under Government Code Section 11126, sub C3. Do I have a motion for numbers 1A through 61 of the Victim Compensation Program?
I move approval of numbers 1A through 61 of the Victim Compensation Program.
And I second.
Council, please call the roll.
Motion before the board is approval of numbers 1A through 61 of the Victim Compensation Program. Member Becton.
Aye.
Member Johnson.
Aye.
Chair Ravel.
Aye.
Motion passes.
Thank you, Council. Is there any other business that needs to come before the board today? Seeing and hearing none, do I have a motion to adjourn?
I move the meeting be adjourned.
And I second.
Please call the roll, Council.
Member Becton.
Aye.
Member Johnson.
Aye.
Chair Ravel.
Aye.
Motion passes.
Thank you, Council. Well, thanks everybody for the great discussion today, and we'll see you again in May.
Thank you.